Lyme disease is an infectious disease caused by Borrelia type bacteria, which is spread by ticks. Our PICO question is, in a community population setting with possible Lyme disease caused by a deer tick, does a positive Lyme ELISA compared to a negative ELISA increase the likelihood of a diagnosis of Lyme disease?
Lyme can have different presentations in different parts of the body depending on the host and the progression of the disease. Common signs and symptoms include rash that looks like a bullseye, flu-like symptoms, headaches, muscle pain, joint pain, fatigue, fever, sweats, and general malaise.
The classic sign of early Lyme disease is a spreading rash called erythema migrans, which is described as having a bullseye appearance. UK studies have suggested only 65% of people notice this, but if the disease is recognized at this early stage and diagnosed clinically without waiting for blood test results, the response to treatment is generally good. Serology testing, which involves an indirect evaluation of the body's immune response to infection, aims to detect antibodies to Borrelia. In the UK, this involves two-tier testing. Stage 1, an EIA or ELISA screening test. If this result is indefinite or positive, the sample is sent to the specialist reference laboratory for further testing. Stage 2, an immunoblot, is carried out with the aim of confirming Lyme disease and identifying false positive EIA results.
It is important to be aware of the risk of tick bites and to avoid walking, especially with exposed skin through deep vegetation and long grass. Wearing long pants tucked into socks can reduce the chance of being bitten. Brushing down clothing afterwards and checking for ticks is always advisable. Insect repellents containing DEET and picaridine are effective against ticks.
The nurse may be the first point of contact for patients presenting with a tick bite, EM rash, or signs of Lyme disease. It is important that the nurse is aware of the key questions to ask, signs to look out for, and how to best manage the situation. Ticks should always be removed promptly to reduce the risk of bacterial transmission using fine-tipped tweezers or a tick removal tool. Ticks should never be squashed or covered in petroleum jelly. Diagnosis is clinical and should be based on known risk factors, clinical presentation, and interpretation of test results. Nurses have the opportunity to play a key role in raising awareness of the disease and its prevention, diagnosis, and treatment.